So growing up here in Africa, I'm now 77 years of age. And it was very promising here in Uganda. And I had a very good education. There were free medical services, initially by colonial people, and then by the independent Ugandan government. I even started working when things were very good. And then Amin came here, things started to go wrong, and they say it is Amin who is the problem, but no, the whole of Africa ended up like Uganda. And that was really brought about by basically Cold War leading to military dictatorships, and there was total collapse in Africa, and we became beggars. And that's part of that. Other things I will show you happened. But now things are better. AU became African, became AU became AU. It's now more about people. And these slides are showing you some of the decline period issues. Those South Asian countries who got independence, like at the same time with us, with the same indices, just overtook us, comparing Ghana and Thailand and Nigeria and Indonesia. And that is effect of HIV. Life expectancy plummeted in many countries. And now we are there. As I told you at the beginning, children die, we say God called them. Women die in labor, they say her day has come, and we really must get away from that. And these are other pressures on Africa now impacting our progress towards UHC. There's still high poverty. Services are overwhelmed because of large populations. There's a lot of dependency on outside, and the can-do attitude has declined. And we have accepted in many countries to live normally with the intolerable. And we really must increase demand side for quality everything from our population. Now that's where we are now after MDGs. We have made a lot of progress, but look, Africa is at the top. There are still much worse indices than other countries, other regions, and we don't want that. And we should be ashamed of this. We should feel pain so that we can cause the change that we need. I'm sorry to be hurrying, but I hope I'm delivering the messages nevertheless. So this is now the new era of hope in Africa. Africa's future is up to Africans. We have to reclaim that can-do attitude, which was taken away basically at the bad time when we were borrowing money from left and right, IMF, World Bank, which country. Those people brought people to sit in our ministries of finance, in our ministries of health, and told us to do things. Stop this, lie down, get up, turn left, turn right. And we lost the can-do attitude, which was there at the time of independence. And as we called for independence. And our independence leaders said, we want independence to free Africa from poverty, from disease, and from ignorance. And we want to go back to that. We need to bring back accountability, ownership, pursuing excellence wherever we are, being partners, particularly between communities and people like us, the techno-professionals. And then being partners with the rest of the world. We need strong governments. We need strong civil society. So the governments are up there, global, regional, and then here in the oval there, those are institutions outside governments, but which can work in partnership with governments. But we must have strong governments to start with. And this is about strong governments. All this is, why governments are called to the UN and not CSOs and so on. And those governments, they go to the people, give us votes, we'll give you a bridge, a hospital, so they have to be accountable. Now, this is now about growing capacity. Capacity grows from what is already there in cognizance of the political and social and cultural environment. And institutions to grow capacity exist in most African countries. So we need to pursue locally driven research, strengthen our management and leadership, strengthen the sharing of information, close the implementation gap, and have good monitoring and evaluation mechanisms. And this, to achieve this, we will also be bold, supported by a new paradigm, a new global paradigm. In the past, when I was Director General in the Ministry of Health, we would go to the Ministry of Finance to look for money every year, budget, and we were classified as an unproductive sector, together with educational. Can you believe? So, but now a change has come. Health is seen now more as an investment and not just as a consumer of resources. This picture, this is me and Professor Paul Collier. He was the chief economist at the World Bank when I was Director General. They was at that time classifying us as a consumptive sector. But I met him about 2 years ago, 2019, in Berlin. And he now has written a book called The Future of Capitalism, where he told us in the meeting in Berlin that for 40 years they have been teaching wrong economics, profit, 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 but not telling the profiteers what to do with their profit, not about the people, the humanity, and so on. So we are now on a new route, and it is possible to achieve good health with the low cost. Other countries have done that, but we need to own this, and we Africans must own the drive to change and stop being a continent of global pity, regain self-pride, and be the owners of this. All these are being talked about in circles where I circulate. And this is from Thailand, the triangle which moves mountains. People like us should get together with our communities, research, understand the needs of the people, and take those needs and solutions to the politicians. You all need to read this report. We held a meeting here, African Health Governance Network, together with African Platform on Human Resources for Health. Why is Africa where it is? You can find that book in our website, the Archest website. So as we conclude, I told you message number 1, we must feel the pain. Message number 2, we need leadership. Each one of us, wherever we are, so that Africa is a continent where we ask Africa, this is Africa, what do you expect? We say only the best. So with that attitude, our journey towards SDGs and universal health coverage will be assured. And last night, some of you watched, the president of Uganda was debating with Dr. Tedros from WHO on vaccines. And basically, President Museveni said that we Africans are sleeping and should wake up. And that is also my message. Thank you very much for listening to me. It's rushed, but I hope the message has been delivered. So with that, we now go back to the panelists. I'm now going to invite our sister. She's much younger than me, Rispa Walumbe from AMREP, to tell us where we are with SDGs. Rispa.
Thank you so much, Prof. And thank you again for the opportunity. I think you've really set the stage for the conversation. And I'm really excited to be here on behalf of course, the Commission, which you and also Dr. Karim here were part of. So I'll also quickly go through the discussion and really just hit the main points around the Commission. And I'll start here by giving an overview of the Commission. So of course, the AHAI Commission is the Africa Health Agenda International Conference Commission. And it's a commission that brought together 11 global health experts from across Africa. We wanted a homegrown, relevant and Africa-specific team to be brought together because we believe we have the expertise. And so we decided to bring together 11 global health experts who would craft a report on the state of universal health coverage in Africa. And of course, this resulted from the discussions in AHIC 2019. And also there were several iterations that were similar to the AHIC Commission, such as the Lancet Commission. So of course, the Secretariat is led and hosted by AMREF South Africa, but really the report is owned by the commissioners and the technical advisors, and more largely is owned by the African people. So this report was not only to describe the state of UHC in Africa, but also to provide recommendations to state and non-state actors. And the approach that we took from this process was really around using the best available evidence from literature reviews, secondary data analysis, but we also saw it important to have in-depth interviews with stakeholders from across the continent, from different countries, representing the different regions within the continent, and also representing the diversity we have within the continent. Then something else we did that I think was very different was we decided to also look at people and look at people's stories. And we decided to collect community stories from across the continent, which also informed the recommendations and the thinking process around this report. And of course, finally, of course, the commissioner deliberations, because again, we brought experts together and we brought them because of their vast knowledge and expertise and experiences living and working on the continent. And so we thought it best to also include their deliberations as part of our report. So of course, phase one of this process was the report creation. But the second phase is this discussion we're having here, which is the dissemination process and really going into the discussions and the implementation. So of course, we had three overarching questions that were really the drivers of our thought process. And the first part was to look at the progress that has been made by African countries towards universal health coverage. The second question, which we grappled with, was looking at the challenges, but also the opportunities that Africa had in terms of embarking on their journey towards universal health coverage or really accelerating that journey. And finally, of course, we made recommendations around that were not just recommendations for the sake of it, but were recommendations that were cognizant of the challenges and opportunities and that were transformative. So a couple of points I wanted to make here is just in terms of identifying just the landscape on the state of UHC in Africa. One, I think is important to note is that there actually is regional commitment towards universal health coverage. The conversations around universal health coverage are very strong and formidable. And I think that this is it's a good foundation for us to really accelerate progress and our implementation processes. The other thing we have is that 93% of African countries actually have a health sector UHC policy or include UHC as a goal in their policies and strategies, which again is critical because that is the foundation and the guiding principles for the institutions responsible for really accelerating UHC. But on the flip side, we also still have 97 million people in Africa still experiencing catastrophic health expenditure. And this has actually increased from 6.6% in 2000 to 8.2% currently. So and then on the other side, we also have, while the proportion of people who are falling into poverty has reduced from the year 2000, we still have health outcomes that are quite lacking in terms of what we are hoping for our ambition, which I think is something that Professor Omaso has alluded to. In comparison to how much we are in terms of the population, we are 17% of the world's population, but we are 23% of the global burden of disease. In terms of service coverage, there are a few pointers here. Firstly, it's that service coverage varies across the region. But even when we compare the people who have high service coverage, when we look at it against quality of care, the quality of care actually is bringing us lower in terms of service coverage. And this varies from the quality of care that people are receiving across different essential services. And then still, this service coverage is still inequitable across the continent in terms of wealth disparity, gender disparity. And also we have a couple of other things here that really encompass all of the discussions we've had, is that there are large variations even within countries and even within a particular country, and across the different countries and the entire region as a whole. Finally, of course, I'll just point out that the mobilization of resources is still a challenge, especially for African countries, because it's affected by inadequate economic performance in some cases, and also not leveraging on the accelerated economic performance where there is some. So I'll just jump straight into the recommendations, and I see I have about 4 minutes left. So first, our state actor recommendations. One, and I think this has been really prioritized by Professor Maswa's introductory remarks, is that health really needs to not only be viewed as a priority, but as an investment. And as he said, as we already had this in place, and we need to look at that, go back to that, even as we had in the post-colonial period, to look at health as a priority and an investment. The second thing we need to do is really rethink how we design our healthcare systems. We need to think through how we orient them, how we apply them to the specific communities that they serve, and make sure that they're more comprehensive, more holistic, and that they're based in primary care, so that we have more flexible models of service in terms of how people are receiving services. And of course, this also, we have to put our money where our mouth is, right? So that includes, when we say redesigning health systems towards primary healthcare, that also includes distributing resources towards primary healthcare as a priority. The other recommendation is also around implementing health financing reforms, but not just implementing them for the sake, but really looking at how they're relevant to the context, the country context. So part of this is also looking at domestic financing. And when we have discussions around domestic financing, we need to really be in charge of our finances in terms of dictating where our resources are placed for the healthcare system. So it will be really important for us to think through how we can start to mobilize resources, or even increase our resource envelope for healthcare, and making sure that it's actually coming from the public resource pool. The other part is also really unpackaging this I call it the animal called strategic purchasing, and really unpackaging it for the context that we're working in, so that we're leveraging it not just for efficiency, but also for governance and accountability of the resources we're trying to pull towards the healthcare system. Now, when it comes to strengthening governance and accountability, the main thing here is to look at political commitment towards UHC. And not just looking at it in the first stage of just announcing it and talking about it, but really looking at political commitment, how it transcends the policy formulation stage, the implementation process, and also the resource mobilization process, because again, it does dictate how we allocate resources and how we prioritize our implementation of our different projects. The other part for strengthening governance and accountability is really having a more cohesive relationship between stakeholders in the political space, in the policy space, and also in the advocacy arena. Finally, for the state actor recommendations is really looking at multi-sectoral and regional collaboration. This is and this I think I'll leave this to Karim to really break it down in terms of how we can leverage the private sector. But I think for state actors, it's really to have an open door policy for discussion. Finally, for the non-state actors, the first thing is to look at regional collaboration across and different institutions and such as even the African Union. And I think we have seen that in light of COVID. The different collaborations we have leveraged. The other part is really on structured leadership and governance programs for really increasing people's capacity within state actors, looking at and using local projects actually as the capacity development process discussion continues, especially if we are looking at leadership development amongst the state actors. And finally, we're looking at the importance of community when it comes to social accountability mechanisms and also putting the community first. I think that is something, again, that Professor Omaswa really emphasized, that we are not working for the sake of creating a system, but the system is really to serve the community. And how do we make sure that we are working around that and putting communities first, and also working with communities to design a system that is focused on them, focused on people. So of course, I cannot say this enough, is that we really need to keep universal health coverage on the agenda and as a priority. And we need to identify windows of opportunity that we can leverage. So thank you so much. I see I'm 1 minute over time. Yeah, thank you.
Thank you, Rispa. That is really solid. Everything is really there in that commission report. So what we need is to popularize it more. And now, Karim, it's your turn to tell us how we can loop in the private sector to be a key player on Africa's journey to UHC. Thank you. Over to you, Karim.
Thank you, Francis. Thank you, Prof. Rispa mentioned it. Almost 100 million people are pushed into extreme poverty each year by the cost of essential health care. And you as well, Prof, you have mentioned that we need a leadership. I think with these two assessments, we have definitely to find a solution. We cannot continue like this. I personally strongly believe that the private sector is well positioned to contribute to the universal health coverage effort and already provides health products and services for many millions of people and communities globally and in Africa in particular. Most countries have a mixed public and private health system. I will now introduce the concept of the for-profit private sectors offers a diverse range of health and related product services and innovation. In some of the countries in Africa, it provides over 60% of health services. Let's have a look very quickly to the principles. Number one, leaving no one behind. A commitment to equity, non-discrimination, and a right-based approach. Health is clearly perceived now, even by the private and profit sector, by a fundamental human right. All partners should promote the core elements of the UHC: access, quality, and financial protection, as mentioned by Professor Omaswa. We need now a full transparency and accountability for results. All partners should act responsibly. We have to adhere to established codes of conduct, operate transparently within a relevant regulatory and legal framework, and recognize their accountability to people and communities. We need also an evidence-based national health strategy and leadership. All partners should ensure their efforts are evidence-based and aligned with national priorities and policies or regional policies, and acknowledge as well and support the roles of the governments, stewardship and public financing in ensuring availability, accessibility, acceptability, and quality of service and product delivery across both public and private sector. International cooperation based on mutual learning and cross-learning is very important. The mutual learning should be fostered among private sector partners and with other stakeholders on how best to support progress toward the universal health coverage. The private sector wants to be part to achieve universal health coverage. We see governments engaging with the private sector now and identifying common interests to foster new partnership for universal health coverage. before getting into partnership, we have clearly set the regulatory processes such as legislation, monitoring, and compliance. I think the private sector have been sometimes, maybe for some reason, stigmatized, but the private sector is not the problem, not even a part of the problem, but we are an important part of the solution. Clearly not the whole solution. Governments need to create the ecosystem, from training of youngsters to regulatory strengthening, to cutting corruption, creating insurance system. The industry can create dynamic solution, create employment, economic progress and development, and create also availability of health product. Neither side can work properly if other does not. The biggest mistake in the pathway to Africa universal health coverage is to think this is only public sector and civil society driven. No, it's really a partnership. Government, communities, private sector, and in the center, the universal health coverage. I mean, even it's a bit surprising. I would suggest that we should, profiting from the profit, we need to make sure that we align the private sector interest with the universal health coverage. A holistic maps of the health system, which include the private sector, can really reveal the new opportunities to accelerate progress in service delivery and reaching UHC. We, because I'm talking here on behalf of the IFPMA, we pharmaceutical companies agree about the importance of a framework for appropriate interaction and to build trust. The pharmaceutical industry is already very well regulated, and it appreciates regulation to ensure that patients get the quality drugs they need. The private sector believes in collaboration and is very well trained for that. I'm sure that you will ask me, and maybe you will think, conflict of interest. Do we have a real conflict of interest? Maybe. But we have been stigmatized, we have been ignored, and we have been discriminated. Despite all this, we are now at the stage that we can manage our conflict of interest, and we should be okay. The promises of the UHC means that there is a technology, innovation, and disruption, and the private sector is really important to actually deliver on that. I will not go through all what the private sectors, because otherwise it's going to take half an hour, but how the private sector can maximize the existing contribution to ESG, yes, we can summarize as follows. One, offer quality products and services that consider the needs of all people, including all poor and marginalized population, and make this affordable, accessible, and sustainable. We have to incorporate UHC principles, including the one to leave no one behind in core business models and objectives. This means a long-term strategy for the profit sector in supporting the UHC. We have to develop, test and scale innovative business models that align with the UHC goals. And innovation can happen on many levels, especially in approaches that help to drive greater and more equitable access, quality, and sustainability of health products. And that's also our role in achieving SDGs and UHC, is to create, adapt, apply, and scale up innovations Private sector innovation is an engine for new products, techniques, and also insight that can improve healthcare and strengthen health systems, whatever they are, public or private, and increase efficiency. And I would like to conclude that the digital health can be game-changing for health system transformation. New technologies and approaches can help countries to leapfrog, even if I don't like this term, along health and development pathway, and rapidly accelerate progress towards us. Thank you very much. Over to you, Francis.
Oh, thank you, Karim. Certainly the private sector is part of the equation. You say it is very well regulated. There is no conflict of interest. And above all, I have heard you say we should all profit from profit. I never heard that before. And I think that is the message of Paul Collier now in his book, The Future of Capitalism. Okay, let's say there are a number of questions and issues on the chat, but I would like to request the participants to raise their hands. You, I hope, are able to do that. In the worst case scenario, if you are not able to raise your hand, you can write your question in the chat or just speak. We have just got 10 minutes left. And the other question for the organizers is it allowed to get more time since we lost time as we move forward? Okay. Any hands up? Now let me look at the participants. No, but there is a question, I think, what is it? I think it's for you, Karim. I see a question there. I would like to hear the ideas about COVID governance in the private sector-based health sector, pharmacies, drug shops, clinics. This I think is a speaker from Uganda. We've had very bad press on the private sector. The hospital facility, the public sector facilities are full, and patients have gone to the private sector and are paying through the nose. So there's been a bad press for the private sector here. Karim, how do you respond to that?
That's a bit, I don't have the answer, basically. I have a general answer because I've been involved in putting in place several solutions in several countries, not in Uganda, definitely. But, you know, what I learned from that is exactly what we, three of us, we shared about UHC in general. I mean, you mentioned leadership. We need clear leadership from the government, you know, when it comes to special situations. And that they have to really enforce some new regulation on emergency regulations. That's clearly the case. Second, the private sector need really to find options and solutions. And in some of the countries, you know, we have been able to decrease the cost of a bed of emergency care, of intensive care in the private sector, you know. This is really where we see that we have to work hand in hand to find the solution. You cannot say I'm the private sector and I have to be profitable full time. No, you have to have a vision for a long-term vision. Yeah, just to make sure that you are serving a cause, a situation which is hopefully, which will not going to last. And this is exceptional situation, and we should take exceptional decision. I mean, I can also answer the delegate, telling him that, do you think that we are happy to see that Africa have received until now only 3% of the total vaccine dose produced all over the world? No, it's not acceptable. It's improving, but even with all the preparation, this topic has required a lot of meeting and a lot of correction. Until now, we are able in the coming weeks to deliver huge quantities to the African market. But believe me, 6 months later, only 3%. It's not nice to hear.
You're on mute, Prof.
You are on mute, Francis.
Rispa, there was a question or a comment on primary health care. There is also a comment on herbal medicines, and there is a comment on reforming education institutions so that the graduates are better able to locally solve problems, African solutions to African issues. Rispa, do you want to comment on any of those?
Yeah, thanks so much. Yes, Prof. I think I'll tackle the first one on primary healthcare and looking at cost of care, because I think that's been a question that is just really on the dovetails well with what Karim was saying around the cost of care being something that we can, of course, work with the private sector to really unpack and identify. Because understanding how much something is at the tail end, it requires us to understand the processes by which we get a particular product, right? And I think this is, again, where collaboration is a really important thing. Because if we start to work together as, even in our purchasing arrangements, right? If we leverage on our purchasing arrangements to focus more on a regional purchasing agreement, perhaps, for instance, if we look at pharmaceuticals, if we look at even technologies for healthcare, I think that will be a really important factor in terms of bringing the cost of care in terms of commodities down. Because again, looking to our neighbors in the north and also some of our neighbors in Asia and other places, this is some of the things that they have done. They have identified themselves as regional economic blocs. They have leveraged on those. They have understood that sometimes it's better to stand with other people. When you are negotiating price, it's better to stand together rather than to stand alone. And but then going back looping back to what you've said about looking at corruption and lack of leadership, I think a lot of it is going to come down to leadership. And that's why I really said, when it comes to political commitment, it's not having political commitment just at the beginning stages, but really having that political commitment transcend the entire process. Because when it comes from the top, all the way from the top, it really does help to keep people aligned and keep people focused. And it also brings people together, because in that commitment, it's already a convening power in itself. And that, of course, aligns the different actors, the private sector, the civil society, and the government. So I'll start with that, unless you want me to take one of the other questions as well, Prof.
Sure. Let's go back to political commitment. How do you mobilize political commitment? Because it seems it is the missing link to everything.
Yeah, that's a good question and a hard one, but I think I'll make an attempt to answer it. I think from what I've observed in terms of political commitment, it also starts with understanding the political space and understanding the political levers that are there, and really packaging, I would say,